Our first guests of the day are Novant Health employees, Shelley Neal and Arlene Farabee. Welcome, Shelley and Arlene. It's such a pleasure to have you guys here today.
Thank you.
So let's begin by learning a little bit about each of you, your education and your background. So Shelley, we'll start with you.
Sure. I'm Shelley Neal, and I work in business development sales with Novant Health. I've been with Novant Health for 8 years. I work with a team of folks that manage the relationships with the insurance carriers. One of my primary roles over the last couple of years is to track the development of the health insurance marketplace.
And that's a big job.
Yes.
Big job.
It's progressed over time,
Right.
from state-based to federal exchange. Yep.
And how about you, Arlene? How are you involved with Novant Health?
I am the Director of Strategic Development, and I work with Novant Health's strategic planning team. And what I do in that capacity is work on new business development initiatives, especially projects that span all of our markets, and the health insurance marketplace is certainly one of those projects.
Certainly it is. Now, I understand that you recently helped to host an event at Novant Health Brunswick Medical Center, and it had to do with a new marketplace exchange or market. What is that really called? See, I can't even.
It's the health insurance marketplace. And yes, we held an event just yesterday afternoon at our Novant Health Brunswick Medical Center. It was an information and enrollment outreach event for the community, and it was very well attended. We had lots of people coming with questions. As you might imagine, people are a little confused and need a little help navigating the marketplace. And we had trained Novant Health staff on site, as well as qualified insurance agents and brokers, and members of the Department of Social Service there to assist people. So individuals could come in and get their questions answered, apply, complete the marketplace application, check to see if they applied for low-cost premiums or subsidies, and also enroll in a plan.
So they were able to enroll yesterday.
Yes, the marketplace was actually up and running.
It was open
and
for business.
Yes.
Open for business.
Well, Shelley, let's shift to you a little bit. Who actually is eligible for coverage through the marketplace?
Sure. The marketplace was developed to build on our current system. So the primary goal is for everyone to have an affordable option of health insurance. So people that are currently uninsured or purchase their own insurance is eligible for coverage to the marketplace. Some individuals and families may qualify for a subsidy. Subsidies are determined based on your household size and household income. So if you purchase insurance to the marketplace, you could qualify for that subsidy. And what I mean by subsidies is the federal government could potentially pay for part of your premiums, depending on if you qualify or not.
I see. So that tells me who might be eligible, but I suppose there is a group who might not be eligible. Can we touch on those for a moment?
Sure. Unfortunately, not everyone is eligible for coverage to the marketplace. Some examples would be undocumented immigrants and folks that are currently in prison. Also, if you have coverage through Medicare or Medicaid, or coverage through your employer, or a family member's employer, then you would want to continue with that coverage.
I see. Well, tell me, what types of health care will marketplace plans cover?
I can answer that.
Great.
The marketplace plans will cover doctor's visits, hospital care, and prescriptions. It'll also cover maternity care and preventive services. And if you're an individual who was not able to purchase health insurance before because of pre-existing conditions, you now have the opportunity to purchase coverage.
I think I did see on TV one of the commercials that said no longer are pre-existing conditions taken into account with the new.
That's right.
And so I think that is a great thing.
Right. It's not taken into account for your premiums, the rate setting, or if you're eligible or not. So everyone can receive coverage.
I think that's a great thing right there. Where might our viewers go to find these plans that are available?
Okay, they can visit healthcare.gov.
Okay.
You can also talk to a person directly through the healthcare.gov 800 number.
I see.
You can visit healthcarenc.org and find a trained agent that may be available in your area. And you also can go directly to Blue Cross and Blue Shield, that's bcbsnc.com, to view available plans.
Would it be possible for them to speak with their own insurance agent or an insurance agent in their community that they might know? Is that a possibility?
Yes, but if you want to see if they're trained through the marketplace, you can visit healthcarenc.org.
And that's an important piece, that they talk with somebody who's been certified.
That's right. Not all agents and brokers have gone through the training. A majority of them probably have, but you can view the agents that have through that website.
Okay, so we've kind of covered that part. Now, how do we enroll in the marketplace? Let's talk about that a little bit.
Sure. To enroll in the marketplace, you have to go to healthcare.gov.
Okay.
Or an agent or broker can assist you with that enrollment process. You can also talk to a navigator or certified application counselor, but an agent or broker probably be the best resource.
Mm-hmm. So, okay, now I'm ready to apply. So what kind of information do I need to have at my fingertips to begin this application process?
Well, anyone who's applying will need to have a Social Security number. They'll need to bring either a W-2 form or a pay stub. And if you currently have insurance, you'll want to bring your policy numbers as well as any information about a plan you may be covered with through either your employer or through a family member's.
Mm-hmm. And where can our viewers learn more about the health insurance marketplace other than the two websites that you've cited? Is there any other way to get this additional information?
Well, at Novant Health, we've tried to simplify things for your viewers and all of the individuals in the communities we serve by consolidating things on our website, which is novanthealth.org/health exchanges.
Okay.
And if they log in there, we've got a lot of frequently asked questions posted. We have information about outreach events that we're holding in various markets, as well as links to some of the sites that you have been previously referenced. So it's a nice one-stop location for people to get information.
Now, we mentioned earlier that folks out there can actually go talk to a broker. If they're unsuccessful on the website or they just have additional questions, they could go to a local broker and talk to them. But I'm curious about the information they might get in terms of cost. Mm-hmm. Would it be more expensive to do it that way as opposed to the website?
Well, actually, for the individual that's looking into the marketplace, whether they purchase in the marketplace or not in the marketplace, whether they purchase through a broker or they walk through the process on their own, the cost of the premiums is exactly the same. So they needn't worry about reaching out to a broker and having to pay an additional fee or commission.
Mm-hmm. Okay. Now I have one more question about the broker. If they go to the broker and try to enroll, would they be eligible for the subsidy?
Absolutely. They have to enroll through the marketplace, and the broker can assist them with that. But if you enroll through the marketplace, then that's where you see if you qualify for a subsidy or not. And the agents and brokers really can help explain the plan options. That's one of the benefits of talking to an agent or broker, to understand the options and the benefit levels.
Mm-hmm. Well, from my perspective, I would think it would be kind of nice to have a person there that you could dialogue with, yes, in addition to the computer and signing up for the marketplace. It's just, sometimes I just prefer to do business face to face.
Right.
And so I think that, a broker might be real helpful.
And you're going to have questions.
Sure.
At the event that we recently held, people came in with lots and lots of questions, and there's nothing better than to have somebody right there to step you through
hold
it,
your hand,
do an apples to apples comparison, let you address any questions that you have.
Mm-hmm. Okay, now I understand that if I qualify and I can go through all the steps and eventually get to enroll in the program. But let's say that I don't qualify. Are there any options out there available to me because I still don't have health insurance? So what options might I take advantage of?
Yes. First, you probably need to make sure that you're not eligible for anything through the marketplace.
And so that's going through the whole process.
That's going through the process. So that's important for people to try and see what they are eligible for. And if you're not eligible, there are options out there for folks that are uninsured. And I would recommend that you start with a financial counselor at Novant Health Brunswick Medical Center.
Let's talk about the timeline. When do I have to have this application made? And then how soon would my insurance take effect, and so on and so forth?
Okay. Well, enrollment started October the 1st of 2013.
Okay.
For your policy to be effective January 1st, 2014, you have to enroll by December 15th, 2013.
Well, that's quite a long time for it.
Yes,
Folks
but the initial enrollment period is extended through March 31st, 2014, but you will not be effective January 1st if you don't enroll before December 15th, 2013. So you still have an option, but your effective date will not be as early as January.
Okay, again, so you have to enroll prior to December 15th?
Yes.
And the insurance will take effect January 1?
Yes.
But if I apply during January to March, when would my insurance take effect?
Well, if it's before the 15th, it'll be the following month.
Oh.
But if it's the 16th, say it's January 16th,
Yes.
it will not be effective until March 1st.
Oh, that's a time there.
Yes.
Yeah. So you would encourage everyone to apply as quickly as possible.
Absolutely.
And, especially given some of the difficulties folks have had and maybe getting together all their information, it's probably better to start the process as soon as possible.
Absolutely. And if you haven't had health insurance before, I would think that you would want to get coverage as soon as possible. So if you meet that December 15th deadline, you'll have availability come January 1st.
Sure.
Right.
Those are great points. I appreciate that. Again, thank you so much for joining us today. It's been a pleasure having both of you, and I look forward to talking with you again to see how successful the enrollment has been.
Thanks, Jude.